Welcome back to another episode of Get Your Head Out of Your Assay. My name is Zach Gerard Levin. I am the CEO and founder of Peapod Bio. And in this series, we talk about assay development and factors that we need to consider beyond the well and the protocol. And today I'm joined by Sarah Martin, who has a lot of experience in developing assays from early discovery all the way through ADME tox. Sarah also has that unique combination of working on the CRO side and from the biotech side. Now, Sarah, you and I are both perfectionists. One of the things that we often struggle with is how do you find that balance between a perfect assay and one that's good enough to launch a drug discovery program?
Absolutely. Happy to dive in with you, and it's great to see you again. Early on in my academic career, I definitely focused on making the perfect assay. I worked for an analytical chemist, and it was all about getting to that perfect number. But then he stopped me at one point and said, "Do you need the perfect number? Sometimes relative answers are good enough." And that stuck with me throughout my career. I met you at SLAS, and I think, because of that perfectionist nature, we had a really good banter about an assay that I was really contemplating the conditions and kind of our perspective from both sides. Is that good with you?
Absolutely. I remember that time.
Yeah, so I remember I was working on an assay, and I had come from the lipid biochemistry side. And in that space, we did a lot of stuff in cells. So I was really used to working with cellular mechanics, all the right salts, cofactor proteins, things like this. This assay was the first time I had experienced a true biochemical assay. As a perfectionist, I wanted to give the protein all the right things, the right salts for physiologic relevance. I think I was overcomplicating the assay. And I remember coming to you because you had a lot of experience helping people navigate, more robust results, especially when you're doing a high throughput assay. So I know in this case, we had something very charged, it was very sticky, and it was causing a lot of variation. And your suggestion was, well, why don't we play with the levels of salt? It may get us to a robust assay to get us good starting places from our initial high throughput screen. Sometimes you need an assay that gives you good answers, and then you can work on the perfection later by, creating a suite of assays that really gets you to the right and perfect answer.
Yeah, that's interesting because a lot of times when we're developing biochemical assays, we're not using physiological substrates. We might be using a peptide instead of a large protein. We may not have all of the accessory proteins available, but we want to make sure that we have something that gives us results, that generates confidence so we can make those critical go or no-go decisions. And it's important then translating those results to the next step or next phase in the drug discovery pipeline. We remember the conditions so we can better align our expectations moving from the biochemical setting into the cellular setting. Thanks, Sarah, for the reminder of that early discussion. And it's great to still have these debates over developing the perfect or good enough assay. Thanks again for joining Get Your Head Out of Your Assay.